studies have shown today that in ALL, especially also an EBMT study, show that comparison of different donors shows that haploidentical transplant is today a very good alternative if a patient doesn't have an adequate donor, because the outcomes with haplo transplants are today, and most of the EBMT studies have shown that. So I think haplo transplant in the ALS setting is today very used. And what we wanted to do in this other acute leukemia working party EBMT study was to compare different GvHD prophylaxis strategies, one which is very known, and that's post-transplant cyclophosphamide, and the other was the ATG, which was mostly in earlier patients, because before the post-transplant cyclophosphamide became almost a standard. So we analyzed ALL haplo patients between 2007 and 2017. So we got a group of 98 ATG patients and 338 post-transplant Cy patients, and those the groups were rather comparable, although ATG patients had more relapsed patients. This is a group of patients that was treated before, earlier than the post-transplant Cy, and the difference. That was all the other characteristics were more or less comparable. And in these patients, we saw similar rates of acute and chronic GvHD. However, patients with post-transplant Cy had better leukemia-free survival and better overall survival, which of course made us then conclude that post-transplant Cy is preferred strategy for the haplo setting in ALL patients, definitely.